The following video is an illustration of the standardized clinical examination based on the diagnostic criteria for temporomandibular disorders.
I will be doing an examination and there are a few instructions that I would like to review with you. The first one is that I will be asking you about pain, and pain is a personal experience. Only you know if you have pain. When I ask you about pain, I want you to answer either yes or no, and if you are not sure, give me your best answer. If you feel pain, I will be asking you if that pain is familiar, and familiar pain refers to pain that is similar or like the pain you may have experienced in the same area during the last 30 days. In addition, if you feel pain in the temple area, I will be asking you if that pain is familiar to any headache that you may have had in the temple region in the last 30 days. Is that clear?
Yes.
For the purpose of this examination, I'm interested about pain that you may experience here, 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 or inside your mouth. Have you experienced pain in any of these areas during the last 30 days?
Yes.
Could you please show me with a fingertip all the areas that you have experienced pain?
Here, here, and here.
Okay, now let me just confirm. Right here,
Yes.
right temporalis, right here,
Yes.
right joint, right here,
Yes.
right masseter, this area as well,
Yes.
left temporalis, right here.
Yes.
Could you please move your jaw forward for me? And come back. Right where my finger is, that was your
Yes.
left joint, and right here as well,
Yes.
left masseter. Have you experienced pain in any other area during the last 30 days?
No.
Sonia, have you experienced any headaches during the last 30 days?
Yes.
Could you please show me with a finger all the areas you have experienced headaches?
Here and here.
Okay, let me just confirm you have pain right here, headaches. Right temporalis, have you experienced headaches here?
Yes.
And here as well?
No.
Right others. Have you experienced headaches in any other areas during the last 30 days?
No.
You're now going to place a pencil mark on your teeth to take some measurements, and I will be able to eliminate them at the end of the examination, okay? Could you please put your back teeth completely together? And reference tooth number 8. Horizontal measurement, 2 millimeters. Open for me, please. Vertical measurement, 2 millimeters. Bite down, please. Midline deviation, 0. Sonia, now what I would like you to do is to put your back teeth completely together, and then you are going to slowly open as much as you can, even if painful, and then you will close and put your back teeth completely together again, and I would like you to repeat that movement 3 times, okay? Corrected deviation. Sonia, now what I would like you to do is to open your mouth as much as you can without feeling any pain or increasing any pain that you may have right now, and I will take a measurement.
Okay.
Okay. 19 millimeters. And now what I would like you to do is to open your mouth as wide as you can, even if painful, and I will take a measurement, okay? .41 millimeters. Close. Did you experience any pain with this movement?
Yes.
Could you show me with a finger where did you experience pain, please?
Here, here, and here.
Okay, let me just confirm the area. Right here.
Yes.
Is this pain familiar?
Yes.
Is familiar to a headache?
Yes.
Right temporalis. Right here as well?
Yes.
Is this pain familiar?
Yes.
Right joint. Right here?
Yes.
Is this pain familiar?
Yes.
Right masseter. Right here? Familiar?
Yes.
Left temporalis. Is this familiar to a headache?
Yes.
Now let me ask you one more question. You mentioned that you have only experienced headaches in this area during the last 30 days. Have you experienced headaches in this area as well?
Yes, I have experienced pain in the last 30 days here.
Yeah. So you have experienced headaches during the last
Yes,
30
headaches.
days in that sense?
Yes.
Okay. Could you please go to question 1 and add left temporalis headache? Have you experienced pain here as well without movement?
Yes.
Left joint, familiar?
Yes.
And this here as well?
Yes.
Left masseter, familiar?
Yes.
Now, if possible, I will try to open your mouth wider using my fingers. If you want me to stop, raise your hand and I will stop immediately. Please open your mouth as wide as you can, even if painful.
50, terminated. Did you experience pain when I was pushing with my fingers?
Yes.
Could you please me show where?
Here, here, and here.
So the same areas that you experienced pain
Yes.
before? And these two, familiar and familiar headache?
Yes.
And this familiar pain.
Yes.
Bilateral temporalis, familiar, familiar headache, bilateral joint, familiar, bilateral masseter, familiar. Okay, Sonia, now what I would like you to do is to open slightly and slide your jaw to the side as much as you can, even if painful. And I will take a measurement. 11 millimeters. Come back. Place your jaw in a comfortable position. Did you experience any pain with that movement?
Yes.
Could you please show me where with a finger?
Here, here, and here.
So here and here,
Yes.
and both sides are familiar and familiar headache.
Yes.
Bilateral temporalis, familiar, familiar headache. Right here.
Yes.
Right joint, is this pain familiar?
Yes.
And here in this region as well.
Yes.
Right masseter, familiar as well.
Yes.
Any place else?
No.
Place your jaw in a comfortable position, and now open just a little bit for me, please. And slide your jaw towards the side as much as you can, even if it's painful, and I will take a measurement. 8 millimeters. Come back. Did you experience any pain with that movement?
No.
Now I would like you to open just a little bit for me and move your jaw forward as much as you can, even if painful, and I will take a measurement. 7 millimeters. Go back. Did you experience any pain with that movement?
No.
Sonia, now what I'm going to do is I'm going to be checking for joint sound. So I will place my fingers in front of your ears, and what I would like you to do is to slowly open as much as you can, even if painful, and slowly close and put your teeth together. And you will repeat this movement 3 times, and I want you to pay attention to both joints, because at the end of the movement I will ask you if you hear or felt any noises, okay?
Right joint, open and close click.
Left TMJ, no sounds. Sonia, did you hear or feel any sounds when you were opening or closing?
Yes.
Where and what do you hear?
I heard a click here.
Left TMJ click. Was that click painful?
Yes.
Was that pain familiar?
Yes.
Okay, Sonia, now I would like you to pay attention to this joint, and what I would like you to do is to slightly open and move your jaw to the side as much as you can, even if painful, and go back to the center and teeth together, and repeat that 2 more times, please. And now towards the side, even if painful. Come back to the center, teeth together, 2 more times. And now forward as much as you can, even if painful. Go back, teeth together, and 2 more times, please. Right TMJ, no joint sounds. Sonia, did you hear any sounds during those movements in this joint?
No.
Now let's do this one. Open a little bit, and now move to the side as much as you can, even if painful, and come back to the center, teeth together. 2 more times, please. Now towards the side as much as you can, even if painful. Go back teeth together 2 more times. And forward as much as you can, even if painful. Go back teeth together 2 more times. No sounds. Sonia, did you hear any sound in this joint when you were doing those movements?
Yes.
What did you hear?
A click.
Was that click painful?
No.
Sonia, now what I'm going to do is I'm going to apply a certain amount of pressure to different areas of your head, face, and jaw. I will ask you about pain, familiar pain, and familiar headache. In addition, I will ask you about referred pain, which refer to whether the pain stays only under my finger or if you feel the pain also anywhere else besides under my finger. Is that clear to you?
Yes.
Temporalis. Pain,
No.
pain,
No.
pain,
No.
negative. Pain,
No.
pain,
No.
pain,
No.
negative. Pain,
Yes.
familiar,
Yes.
familiar headache,
Yes.
referred.
No.
Pain,
Yes.
familiar,
Yes.
familiar headache,
Yes.
referred.
No.
Pain,
Yes.
familiar,
Yes.
familiar headache,
Yes.
refer.
No.
Positive, 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 negative. Masseter. Pain,
No.
pain,
No.
pain,
No.
negative. Pain,
No.
pain,
Yes.
familiar,
Yes.
referred.
Yes.
Can you show me where, please?
My eye.
Positive, positive, positive. Pain,
No.
pain,
No.
pain.
No.
Temporalis. Pain,
No.
pain,
No.
pain,
No.
negative. Pain,
No.
pain,
No.
pain,
No.
negative. Pain,
No.
pain,
Yes.
familiar,
Yes.
familiar headache,
Yes.
referred.
No.
Pain,
No.
Positive, 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 non-refer. Masseter.
pain,
No.
pain,
No.
pain,
No.
negative. Pain,
No.
pain,
Yes.
familiar,
Yes.
refer.
Yes.
Could you show me where?
Right here.
Stay in this area.
Yes.
Pain?
No.
Positive, familiar, no refer. Pain?
No.
Pain?
No.
Pain.
No.
Negative. TMJ. Now, could you please open your mouth for me? Open a little bit more, please. And now close and place it in a comfortable position. Pain?
No.
Negative. Open for me, please. Open a little bit more and close. Open and close and place your jaw in a comfortable position. Pain?
Yes.
Familiar?
Yes.
Refer?
No.
Now move your jaw forward for me, please. And back. And move it forward again. And hold it right there. Pain?
No.
Negative. Now move your jaw forward for me, please. And back. And forward again. And hold it right there, please. Pain?
Yes.
Familiar?
Yes.
Refer?
No.
Place your jaw in a comfortable position. Pain?
No.
Pain?
No.
Negative. Place your jaw in a comfortable position. Pain?
No.
Negative. Pain?
No.
Negative. Now open your mouth a little bit, please. And slide your jaw towards my finger. Pain?
No.
Pain. Towards the side. Don't open too much. Just to the side your jaw. Pain?
No.
Pain.
No.
This concludes the standardized examination protocol. The clinical procedures illustrated in this video are incorporated into the decision trees based on the diagnostic criteria for temporomandibular disorders. The first tree illustrates the pain-related TMD and headache. And the second tree illustrates the intra-articular and degenerative joint disorders. Further information can be obtained from the International RDC TMD Consortium website.